Welcome back to the St. Baldrick's Impact Series. My name is Kathleen Ruddy, and today I'm pleased to welcome Lea Mayer. Lea is a pediatric oncology nurse practitioner who first became involved in St. Baldrick's in 2011 when she helped establish Hawaii's first St. Baldrick's event. Since then, she's been a dedicated clinician and nursing researcher who's worked internationally to advance the treatment of children with cancer. Today, she works to conquer kids' cancer from her new home at Lurie Children's Hospital in Chicago, Illinois. Welcome, Lea.
Thank you so much, Kathleen. I'm really excited to be here today, and I'm really grateful for the opportunity to share my experiences.
Well, I can't wait for our audience to hear from you because you have so much rich experience. Let's jump right in. So, Lea, what was it that made you choose a career in nursing? And in particular, why did you specialize in childhood cancer?
That is a very interesting, hopefully I'll make fairly succinct story. Originally, I was on a path to med school to be some sort of doctor who took care of kids. Pediatric and healthcare has always been my calling. I don't know where it came from, but I always knew that it was what I was meant to do. And I was really fortunate that my college, a really small college called Juniata in Huntington, Pennsylvania, strongly encouraged us as students to spend time during the summer between their junior and senior year shadowing in their intended career field. So it was during this time that I thankfully had a very insightful physician that I was following, truly listened to what my vision for my career was, and actually suggested that I'm probably more interested in nursing and set me up with some experience that was shadowing that. So when I returned to my senior year, day one, immediately swapped from pre-med to pre-nursing. Kind of getting into nursing in childhood cancer, I would have to say it's kind of kismet and was a little bit voluntold, but truly believe it's where I was meant to be, and I couldn't imagine doing anything else. My husband's job moved us from Baltimore, Maryland to Oahu, Hawaii. Yes, it was amazing, where I was fortunate to get an inpatient RN job on a pediatric unit that also cared for kiddos with cancer. So it was my first experience as a nurse doing that. At that same time, I was working towards my master's degree to become a pediatric nurse practitioner. And as fate would have it, again, I really think things happen as they're meant to be, not how you plan. The facility's pediatric hematology oncology nurse practitioner was leaving at the same time I was graduating from that program. So she and the oncologist, shout out to Florence Wen and Dr. Tanya Cradaville for some mentorship and foresight into my life path. They strongly encouraged me to apply for that role. I was really hesitant, honestly, initially, just because I didn't know if I wanted to go so specialized for my first nurse practitioner job. And honestly, I was actually more nervous about my heart. I didn't know if I could handle taking care of only oncology patients every single day, because it's easy and it's hard. But then towards my graduation, I lost two incredible patients that I was really close to their families from cancer within about a week of each other. And I knew that I had to do more. And the best choice ever. It's been my mission ever since. And being a nurse practitioner on oncology is truly the best and can be the absolute worst job in the world. And again, I can't imagine doing anything else.
I think it takes a lot of courage to come back day after day for that when your heart does go through so much. And I think nurses, from what I've learned over the years, is that nurses spend a lot more time with the patients, and you see them in the middle of the night and all those times where doctors can't be there. So you really are side by side with that family at every step of the way and in the hardest moments.
Yeah, I have to agree. And sometimes when you're, especially like the inpatient registered nurse, that RN role, you're with them for 8 or 12 hours straight. And again, like you said, kind of the worst moments always seem to be at like Saturday morning at 2 a.m. and you're the only one there. And yeah, you definitely bond with them and get to be connected in ways that other physicians, even me now as a nurse practitioner, I don't get that connection.
I think so many people these days are looking for that kind of meaning in their world, and they're, beyond their own family and their love and care for their family, they're looking for it in their work in their volunteer roles, and very few, I think, get to have the kind of privileged exposure and relationships that you do. But it asks a lot of you. So let's switch gears for a moment. You helped, as I mentioned earlier, establish the first ever St. Baldrick's event in Hawaii. And you did that when you worked at Tripler Army Medical Center in Honolulu, I believe. Why were you and your colleagues inspired to do that?
I have to say it all comes down to one person. So while I was working in that NP role, we had a new hem-onc physician transfer to us, Dr. Jeremy Edwards, who had been participating in St. Baldrick's events on the mainland. I had never heard of St. Baldrick's or these head shavings event before he came and joined us. And he suggested that we organize one. And we quickly realized that a St. Baldrick's event had never been hosted in Hawaii. So we, as Tripler Army Medical Center Oncology, collaborated with our oncology counterparts from Kapiolani Medical Center, because we had a joint tumor board with them, in each organizing our own teams, our own patients and families, bringing together the patients, the families, and both the military community and the island community just around a central cause. We were inspired by the daily work that we do to do more, as well as bring together for a really fun event for a great cause, which is exactly what St. Baldrick's is. That first event, like you said, was in 2011. We had over 220 people shave and raised more than $100,000. And it actually continues on annually. The last event was just 2 weeks ago. That's still being led by one of the families I cared for at that time. So it's just really empowering to also see something bring people together and be so inspiring that it continues on kind of as a legacy.
That is a powerful legacy, and it allows other people to share in it. I think, though, that many people don't realize the significant role that the nursing profession, both RNs and nurse practitioners, play in clinical research. And of course, St. Baldrick's events support research of all kinds. So what prompted you to become involved with research for childhood cancer and as part of your career focus? And tell us about the aims of your research, the focus of your research, if you would.
Okay, many questions. I'll try to make sure I hit all of them. As soon as you step into the pediatric cancer world and healthcare, you're either contributing to or working from the results of pediatric cancer research due to the collaborative efforts of Children's Oncology Group. All of our treatment protocols and regimens are coming from the work produced from this collaboration. And I'm really fortunate and actually strategically choose that all of the institutions that I've ever worked for have been and continue to be a part of this collaboration. Nurses, both RNs and advanced practice, are an integral part of the research work because we're pretty much the collectors and documenters of the research data, as well as many nurses, both advanced practice, bedside, RNs, leading research initiatives and informing research protocol design and implementation. I have to say, though I had been working in it for quite a while and understand Children's Oncology Group and children with cancer, my understanding of the importance of research and it's recognizing the importance of the nursing role in it really didn't come until after Hawaii, when I started a role at the clinical center with the National Institutes of Health, NIH, in Bethesda, and being a part of and seeing that bench to bedside research being conducted there with the National Cancer Institute Peds Oncology Branch and the National Heart, Lung, and Blood Institute. Since that role, it became important to me that any job and role that I ever have includes participating in and supporting the conduction of childhood cancer research. And that's because it's only through this research that we can really actually improve childhood cancer outcomes. That being said, outcomes not only focusing on the cure of cancer, which is the most important, but also minimizing the cost of curing cancer, right? All those short-term, late-term, long-term effects that shorten the lifespan of our kids who survived cancer, both for them and their families, both physically and psychologically.
Important work, to be sure. And I love the way you showed the integration between and the the collaboration between the national efforts and institutional efforts. So after your stint at the National Institutes of Health, you moved to Abu Dhabi. So what differences did you observe in approaches to childhood cancer research and treatment in the Middle East?
So it seems like I job hop quite a bit, but fortunately, my husband's job no longer has us moving around. When I transitioned out to the United Arab Emirates, I was working with Sheikh Khalifa Medical City, which was managed by Cleveland Clinic at the time. It was super interesting just to be in a completely different healthcare environment and just a completely different culture as far as healthcare goes. Childhood cancer care was a national priority there, a new priority, because right, they're still building their infrastructure as a country. And they were still working on actively trying to catch up with the United States and Western Europe. So the childhood cancer care, that infrastructure was still being built, and I got to be a part of that build. And that was just a great learning opportunity for me. Children there at the time were being cared for based on Children's Oncology Group, COG treatment regimens, but we were not able to enroll on study or collect and contribute our data to the research because just some of the necessary components were not there. Again, we're building the infrastructure. So for example, at the time, this is not current, this was a while ago now, there wasn't equipment to test for MRD, which is minimal residual disease and leukemia. Not all chemotherapy medications were available. The role of the CRA, our clinical research associates, didn't exist, nor were there resources for a research team. I was the only advanced practice nurse for my entire facility. And we didn't have the facilities for pediatric stem cell transplant at all. So many of these patients actually ended up having to go overseas for treatment.
That's a big burden for a child who's already sick. And there's the financial cost and all of that. And taking that child away from their extended family and support system. But it sounds like you had an incredible opportunity to add another chapter to your legacy in your time in service there. So
I did, and I was really fortunate.
Yeah, it sounds like it. And I think the kids there in the Emirates are as well. So you've been stateside again for about 5 years, and we mentioned you're at Lurie Children's Hospital, Chicago. Tell us more about the work you're doing now and about current directions for your research.
So yes, fortunately, I ended up at Lurie. When I came back from overseas, my husband had a job that would have us be able to settle down. So I actually interviewed all over the country and took my time finding the right job because I had a very clear vision of what I wanted to do, the job I wanted to do, and the resources I would need around me from a facility to do that job. So interviewing all over, I ended up at Lurie. So Lurie is a fantastic, dedicated pediatric hospital that has a very large oncology program. Our oncology program alone is quite large, such that we're divided into 3 teams. We have our hemalignancy team, which takes care of all of the leukemias and lymphomas. We have neuro-oncology, taking care of all the brain and CNS tumors, and then solid tumor, taking care of everything else. We also have separate and dedicated stem cell transplant and survivorship programs. My role specifically, I am an outpatient nurse practitioner with a solid tumor team. So that's the focus of my clinical practice and my research. As a COG institution, Lurie has a large oncology research program and an awesome, like we literally could not do what we do without our research team that supports all of our efforts. The other really unique and awesome thing that I love about Lurie is that we also have the Stanley Manny Children's Research Institute affiliated with us, where many of our oncologists are actually doing research in the lab setting. So truly from my NIH time, being able to translate that bench to bedside, because again, research is everything. My specific role is ensuring the awesome comprehensive care of my kiddos and their families. So I have a dedicated set patient list, and in collaboration with the patient's dedicated attending oncologist, the fellow and RN, my inpatient teams. I also have the benefit of a multidisciplinary team that is integral to the excellent care that I wanted to perform and again was looking for in my job search. So I have dedicated pediatric hemonc pharmacists, social workers, child life specialists, chaplains, dietitian, and all of the therapists, right? Art therapy, music therapy, physical therapy, occupational therapy. It really takes a village to provide the care that these patients and their families not only need, but they deserve. And unfortunately, not all organizations have that. So I can't do my job as optimally as I would like without those. So part of my passionate advocacy is trying to get all of the resources for all of the things for all of the patients.
It sounds incredibly, almost like a military operation in a way, where there's so many moving parts that need to be coordinated with specificity and exacting delivery and performance, and because lives depend on it.
Yeah, absolutely. And then the second part of your question, from a research standpoint, my role involves conducting patient exams. So I'm seeing them in clinic, I'm clearing them for chemo, yes or no. I'm managing treatment side effects. I'm ordering and evaluating labs, imaging, diagnostic testing, ordering chemotherapy, consenting to some research protocols, and just ensuring data collection for all of the research that we're trying to do.
Because you want to make sure every child's journey can contribute to the body of knowledge. That is so importantly. It's a massive job, but somehow, in addition to all those things you've just described, you're also an active advocate with St. Baldrick's. You recently completed the St. Baldrick's Care Training Program. Tell us about why advocacy is important to you.
Advocacy, honestly, it's important to me because I'm really tired of going to patient funerals. I'm tired of the tiny caskets. I'm tired of the role reversal of parents burying their children instead of children burying their parents. My advocacy is a direct fight against this. We need to put the natural order back into things. Children need to have healthful, fruitful, thriving childhoods, and cancer just interrupts all of that. So that's why I'm an advocate, because I'm seeing it every day, all day. And I just feel like I can do better. So part of that doing better is completing this care training program. I think it's a great program that St. Baldrick's has recently created because it helps literally anyone. You don't need to be a nurse practitioner. You don't need to be a nurse. You don't need to have a college degree. Anyone can complete this program, and it helps you become a strong and informed advocate for pediatric cancer research and how to ask for allocation of resources to that cause. The program provides a simple education about research, advocacy, and I participated because, one, I'm dedicated to St. Baldrick's and its cause, right? You guys are the largest private contributor to pediatric cancer research, and I want to help that. But also, I want to also be the most informed advocate so I can advocate for both St. Baldrick's and pediatric cancer.
So taking that to the next step, you had the opportunity to put your training into practice because you recently participated at Childhood Cancer Action Days in Washington, D.C. And while there, you connected with fellow Chicagoans, St. Baldrick's Ambassador Jonah, his mom Stephanie, and his big brother Noah. And I will tell you, I was able to spend a little bit of time with the four of you, and you seem very close and like an extended family. Can you talk a little bit, Lee, about the special connection that caregivers have with families of children with cancer?
Yeah, I have to say your observation is interesting, and you're not the only one that stated it to me. A couple of people asked how long I had known Jonah and his family afterwards. But this connection between me and the family that you observed, I had known them less than 24 hours. We met as the Illinois delegation at the end of our training day for the action day on Capitol Hill. But I agree that connection was instant. It was amazing. And I think it just speaks to the nature of oncology nursing and the childhood cancer experience. While I didn't know them prior to DC, I understood from my professional experience what their cancer journey had been and continues to be, right? He is in remission, he is cured, but there again is a cost to that cure. I understand the struggles that they did and still continue to face and the sacrifices that had to be made during that acute phase, but continue to have to be made because, again, the cost for cure. And while this family did not know me, they recognized me as the nurse, the nursing professional. They understood I only take care of kiddos with cancer. They remember that it was often that bedside nurse in the middle of the night or the nurse practitioner that was seeing them at the best and actually the very worst moments of their life, experiencing that cancer journey right alongside them, we get to see the things that even the closest to family members and the bestest of friends, like all of the support that these families have, we see things that those people never get to see. So there's just a bond and an intimacy that comes with that vulnerability, that experience, and that understanding. And I think this is the reason that nursing continues to be the most trusted profession, right? Because we're there, we see. That being said, I still don't think, even as nurse practitioners, that we truly ever understand. Again, we accompany alongside them, but we can't really understand anyone's experience until we have our own child with cancer. So for that reason, I've actually participated in the Alliance for Childhood Cancer's Action Day on Capitol Hill for the last 3 years, but this was my first time in person, and it was awesome. I highly recommend it. I know it can seem intimidating, but all of the support and structure is there to kind of help you be the best that you can be and do a great job advocating if you're at all interested.
So listening to you, it's obvious why you wanted to be at Action Days and why you are kind of elevating your commitment and looking for more ways to help. What advice would you offer to other nurses and advanced practice providers who may be listening?
For those not working in pediatric oncology, my advice is advocate. It's easy. It comes in so many forms, whatever your level of comfort and time availability is, right? Being an advocate is simply being a voice for what is important to you. For my nurses and advanced practice providers that are in pediatric hematology oncology, this is advocating from the bench to the bedside to national, from participating in awareness or fundraising campaigns about childhood cancer, as simple as just sharing something on your social media, to emailing your state and national Congress people about initiatives about or funding for childhood cancer resources, or going national, going and standing on Capitol Hill. It is a part of our nursing ethics to be patient advocates. I do think our code of ethics really means the patient literally in front of you that you're taking care of and making sure you're giving them the voice within the facility that they need you to. But I do think advocacy means going from the patient in front of us, as well as you gain your confidence and competence, to representing patients and families experiencing cancer who aren't in front of you. And that's what's important to me. And it's important to me to attend as a provider because I've been taking care of children with cancer for almost 20 years. And I can truly see the difference that funding for research and research has made on pediatric cancer outcomes. Diagnoses that had a terrible prognosis early in my career now have better outcomes. They're surviving when they didn't used to. And there are new treatment options every single day because of the efforts that are going on in research. And this is all because of advocacy and funding for the research. Without it, we wouldn't have gone from less than 40% survival 50 years ago to over 80% today. That's huge. And research can only happen, again, if it has money. Money for childhood cancer research predominantly comes from the US government budget. And that's where our action days come in. This is why I go. If our government officials that we're electing don't know that this resource allocation, this putting money towards this thing makes a difference, if they don't understand or know they should support it, they're not going to. That money, they're going to choose to go somewhere else because someone else advocated and informed them. So it's important to me, both personally and professionally. It's my mission, my responsibility to ensure that my elected officials understand and support.
Lea, that was very powerful. And I want to thank you for your focus, your clarity, determination, I think is strong in you. And obviously, your dedication is so high. And you've been so honest and forthright sharing with us today. And I really appreciate you sharing all of your experience. You've truly seen it all.
I have, and I really appreciate your time and St. Baldrick's for all of its awesomeness because, right, you guys are also out there doing all of the funding. So this is how I get to retirement and being unemployed because my job is no longer necessary.
We're here. That is our ultimate mission, is making St. Baldrick's no longer needed, because we can cure every child and ensure they have a great quality of life. That is the ultimate goal. Well said. So thank you, Lea, for being with us today. And to our audience, please share this important episode on your social channels and tune in next time, because research is hope and you are the givers of hope to kids with cancer. Learn how at stbaldricks.org.